Hello everyone, Lori from Women's Health on the Go. Welcome to our Monday night show. We're going to get everything started here. As you know, I usually go on 10 minutes before the show actually starts just to get us all ready and give us a time to get on. Tonight, we're going to be doing a little bit of a different format that we've been doing before. As we're going forward in 2018, I decided that it's really important to me. I love research. I read it all the time, and I think that there's a lot of great things that are actually happening in the research world that is about holistic and natural ways to take care of ourselves. And I think that it's really important that we know what's going on out there. So I decided that I'm going to try every other week just doing holistic, natural news. Reading I have different magazines I read different websites, and just to bring to you, to see, for you guys to know what's going on in the background of medicine. This is the pre-show. Again, my name is Lori Faulkner. I'm part of Women's Health on the Go, where I consult women about their bodies, about taking care of them conventionally and naturally. I'm a certified aromatherapist and also an herbal educator for women as well. And I am very, very passionate about doing these shows and educating you guys about your body and how can you take care of yourselves. So if you are here, please shout out. Say hello. Let me know where you're from. And if you can, share this video to me. The more we put this information out there, the better. Share it with your friends. If you have a girlfriend that you know that would be interested in this, then please do that as well. So if you can share this video while you're waiting, that would also be so wonderful. So I have a question. How many of you women out there actually look at holistic health, holistic news? Are you out there reading holistic, natural kind of magazines out there? So I'm going to just make sure that we are going live. I think, yep, I look like I'm still going here. If you are here, please make sure that you say hello and let me know where you are from. We had a little bit of snow today, not a lot, a little bit of a covering, but it is mighty cold out there. And hopefully wherever you are, I can hear from you. And maybe, is there anybody out there that's in Florida or somewhere down south where it's really, really nice and warm? So again, everyone, Lori from Women's Health on the Go. This is our pre-show. This is when we just get on. I just make sure that everything is going appropriately. We're going to be doing holistic, natural news. I basically love reading. I love reading research. I have all different kinds of magazines that I read. This is a great one. What Doctors Don't Tell You. This is really a great magazine. It goes over, and it's all like research based. These are, it's research based. That's where I love. I love when we look at stuff that's being advertised on Facebook or advertised on TV. I think that it's really important that we go a little bit further to find out if actually is it true and what is the actual research that found that to be true. Because I think that sometimes things are kind of wiggled into a certain way and portrayed that it's great for something when really I think that we really need to do our research, and we really have to, everyone has to do their own research for their own bodies, for their own health. Because at the end of the day, it's your body. I know I'm a women's health nurse practitioner. I'm a certified aromatherapist. I've got certified in herbal medicine for women. And it's my job to inform you and to tell you what you can, what you cannot, guide you through, just to guide you through your health, through your healthy path, right? The path that you want to take. But at the end of the day, it's each of our own responsibility to, take care of ourselves and to figure out, is this the right path for me? I'm always all about making sure that I talk about conventional and also a natural, holistic remedies and paths of taking care of ourselves. So, because I think that it's important to tell you everything. Some people don't mind conventional medicine and they actually like conventional medicine. And you know what? That is their right and that is their choice. And then there's people who like to just use natural health. That is their choice. And then there's the people who do a little bit of combination of both, right? So I think that we all have to make our own decision in our own bodies. And that's why I like doing this show and I like talking about all these things to spark your mind, to get you going and saying, hey, maybe, this conventional stuff is not like what I thought it is. And, ooh, that here's a little bit of an idea that I can take and do a different path for my health. Because a lot of times people actually come to holistic practitioners when they're fed up. Like they have something going on. They've been going to their doctor. They've tried this treatment, tried that treatment, this treatment, that treatment, and it just doesn't work out. And so that's how a lot of holistic practitioners, how people end up going to holistic practitioners. And so I think that, I think it's all about educating. I think it's very, very important that we kind of do that. And that's why I love doing what I do. So in the year of 2018, every other week, what I want to do is I want to come on here and I want to talk about what latest research I found, what was the study, why was it done, what was the findings. Like I have a research that's on, one is about essential oil. I think that the essential oils are awesome. But I don't know if people realize that they're actually doing research to show the benefits of these essential oils. And to me, that's really important because, there'll be some people like, oh, what's that hoobie-jooby stuff? Well, that hoobie-jooby stuff, there's actually research on it proving that it actually is beneficial and it works. So I'm going to bring something about essential oil. And then there's this really great research about I talk about this a couple of times throughout my shows about how we have a gut microbiome. We have good bacteria that's in our gut. And I really talk a lot about the bacteria of the vagina because, that's my specialty and how we have good bacteria in the vagina and how it helps prevent infections and stuff. Well, this research was done about breast tissue and bacteria, a microbiome of the breast tissue, which I think is so amazing that I think this microbiome, I think is the more research they do, we're going to be finding out a lot of stuff about it. That's going to be, it's going to be good. We're going to be talking more about gut and body bacteria and how we have to maintain this good bacteria in our body. And then the last research that I have is about artificial sweeteners. I think that there are so many. I've actually thought about doing a show just on the different types of sweeteners out there. Any kind of sugars. There's sugar, there's honey, there's Splenda, there's stevia, there's so many actually that there's this one that there is talking in this research that is called Sweet One. That's one of the names that it's called, one of the brand names that it's called. And just how the risk with diabetes with some of these artificial sweeteners, which we think that artificial sweeteners, when they say no sugar or low sugar product, they're actually healthy for us. But are they? Are they really healthy for us? Are they, when people are diabetic and they're using them, are they really beneficial when their research is showing that it can affect the way that our body, our blood sugars are controlled? So there's just so much that we think that artificial sweeteners. We think, okay, I've got diabetes. I need to use an artificial sweetener because I can't have anything with sugar in it because it may affect my blood sugar levels. Yet, maybe you're using something that it will affect your blood sugar levels. So anyway, we're going to get started here, everyone. As you can see, the clock is going down, and we are going to get the show started, everybody. So hold on tight. Here we go. Hello, everyone. Lori from Women's Health on the Go. Welcome to our Monday night show. Tonight, we're going to be doing a little bit of a different format. So if you're usually here, it's going to be a little different tonight. Tonight, we're going to be talking about holistic news. We're going to be talking about whatever. I'm going to be going every other week. I'm going to be finding research, whatever is interesting, and I'm going to present it to you because I think it's really, really, really important that when we talk about this holistic and natural ways and these remedies, there's research that's backing it up, and I think that it's really important that we know this stuff. So that's what we're going to be talking about tonight. My name is Lori Falkware. I'm part of Women's Health on the Go, where I consult and educate women about their bodies, conventional and holistic approaches. And I'm also a certified aromatherapist and an herbal medicine for women educator. And I'm also so passionate about educating you about your bodies. And this is why I do this show every week at Monday at 8 p.m. So if you want to get reminders of our show, just comment below reminders, and we'll put you into a little tickler system. So again, tonight we're going to be talking about holistic news. If you have been here before, you know I love engagement. Say hello. Tell me questions. If you agree with something, tell me agree. Tell me you don't agree. Tell me whatever it is that you want. I love engagement. I love when you comment and let me know what's going on for you. And you can please share this video as well. If you can share this with if you know you have a certain girlfriend that will like to hear this, put in the comments @ and their name, or just share it into your feed, and that would be wonderful. So again, what are we going to be talking about? We're going to be talking about holistic news. I've got 3 really great research articles that I found, and they kind of really definitely pertain to women, and I'm really, really excited to bring them to you, okay? So, but as you know, if you watch my show, I have to put a medical disclaimer out there. So all material provided in this video is for information and educational purposes only, and is not intended to replace the care of your medical care provider. Nothing is meant to diagnose, treat, cure, prevent any kind of disease. Statements in this video have not been evaluated by the FDA, and we are not making any medical claims. Also, if I talk about essential oils, the International Federation of Aromatherapists does not recommend the internal use of essential oils unless you're under the care of a healthcare provider that is certified in aromatherapy. And if you're breastfeeding or pregnant, please consult your healthcare provider. And remember to honor our bodies. Our bodies this is the ship that we are flying in this life, and we need to take care of it. So please make sure, let's take care of it, okay? All right, so what do I got in the news? Well, this one I wanted to bring to you because I think that it's about an essential oil. It's about lavender essential oil. And the reason why I wanted to bring it to your attention is because I think it's really important that there's so much information about essential oils out there. And I'm not quite always sure if it's valid information. I think sometimes people are putting information out there about essential oils that might not be researched. They're telling you to do a certain thing, and it's maybe not the best thing to do. Especially if you have a certain medical condition. So I want people to know that when it comes to essential oils, there's research being done, and it is proving that essential oils are very, beneficial. So that's why I'm presenting this research. So this research was published first in November, just in November of 2017. And basically the purpose of it was to evaluate the efficacy of lavender essential oil being used in reducing perioperative anxiety in an ambulatory surgery center. These patients were going under otolaryngeo, basically nose, throat kind of surgery, and like an outpatient kind of surgery setting. And what they did is they compared two different groups, one that used lavender as compared to the other that didn't. They actually used a very, very cool, to me, cool patch. I'm going to show you. I have a picture of it. So look at this kind of patch. I think this is really, really cool. So you're able to just put it on your clothes, if you can kind of see there. And you might not be able to really see on the actual patch, but depending on if you wanted a lot of scent or like a very strong scent or a very light scent, depending on what you want, you can choose the level of the scent that you're actually, smelling, okay? I thought that patch was amazing. I just thought it was so amazing because I'm thinking, how are they going to provide it? Are they doing it like a diffusion in the room? How are they going to do it? It's very personal. Some people sell like necklaces that have little like cotton swabs inside them where you can, put the essential oil in there and then you can smell it this way. But I think that this, especially if we're going to be doing it in a medical facility, this is a very good way to, I'm just going to take a look at it again. It's just a little patch that you put on your clothes. And I just think that is like so cool. So, so what they did is they compared the two groups, okay, to see if using lavender essential oil would reduce the anxiety for these patients before surgery and then how they fared afterwards. And they actually found that the aromatherapy group had a lot better outcome than the other group. And one of the things that they definitely want to look to see to use this more because of the fact that when people, let's face it, I would say probably 99.9% of the people who are going to have surgery have some kind of anxiety. You're going under. It's dangerous. No matter what the situation is, it's a huge thing to go through. And a lot of the times they'll prescribe, either a sedative or they'll do some kind of opioid before. And unfortunately, those things have side effects. You have fatigue, you have confusion, you have sometimes restlessness that can happen. And it also can inhibit the patient's capability to actually actively participate, even like after the surgery. Because if you're all like, hey baby, how you doing? Because you're still having the effects of that other medication, then you might not be able to comprehend what are your post-operative instructions. A lot of the times after surgery, the doctor will be like, okay, hey, everything's fine, everything went good, and the doctor may tell you something, and he's not going to remember. You're not going to remember because you're having these other kind of drugs in you. So where if you had just the lavender essential oil diffusing, then it's a lot simpler. It's safe. It's cost effective. Oh my goodness! If you think about what does one drug cost in any kind of hospital or surgery center, you're definitely going to have a decrease amount of, it's going to be very more cost effective. I couldn't think of the words right there. So now if you're a little bit more interested in lavender essential oil, I'm going to put a link here. I did actually a show on lavender essential oil. I'm going to copy it right into the comments. There we go. Copy that right into the comments. And so if you wanted to watch that show, it goes a little bit more in depth into lavender essential oil. Please click on that link. And also if you were thinking about purchasing any lavender essential oil, I'm using this company, Plant Therapy. I really, really like them to the point where I wasn't going to become an affiliate of anything, and I decided that I was going to kind of a little bit support the show that I'm doing here, because I do this all, I don't have any funding for it, so I try to give a little bit, so I decided to become affiliate of this essential oil company, and I really, really like them. They do their testing. They work with Robert Tisserand, which if you ever watch my shows about essential oils, you know that I love that man. He's been working with essential oils for over like 40 years, and it's very into research and safety, so I love that. So the point of this whole research, of why I wanted to bring it to you, is the fact that essential oils are being researched. They are showing that there is benefits to essential oils. That's the whole point of that. And that the fact that lavender is very good. It's very relaxing. It's very good for anxiety. It's good for depression. Sometimes if I'm having a rough day, I get my carrier oil. I put a couple of drops of lavender, and I put it here. I put it on my neck. I put it on my arms. I put it everywhere, and then I go to bed. Hello, Mary Ellen. How are you this evening? I hope you're doing fine. Tonight we're doing a little bit of a different kind of format. I am doing holistic news. I just did a great one about lavender essential oil and how it actually helped in pre-operative anxiety. So it was. I love essential oils, and there is research out there that is actually proving that they are beneficial. Now, this next holistic news, I think, is really important for us as women to know. Now, if you've watched any of my shows before, I've talked about the good bacteria that's in our gut. I've talked about the good bacteria that's in our vagina. And now there has been research that was done on breast tissue and the microbiome of your breast tissue. Now, this is so important, because what they wanted to do is they wanted to see, does the breast tissue have bacteria, a microbiome of its own, and was the microbiome different from women who don't have cancer to women who do have cancer? And it actually shows that there is a difference. So to me, this is very, very, very important. We are doing a lot more. There's more research that's coming out about gut bacteria. I said about vaginal bacteria. There are this theory that people are starting to come out that every organ system has its own bacteria colony, I guess we'll call it, okay? And how all of this bacteria keeps everything in check, right? So we've talked about gut bacteria, about how there's good bacteria in our gut that keeps everything functioning and healthy. We have good bacteria in our vagina that helps fight off infections. And here they're finding out that there is certain bacteria in our breast tissue, and that if we end up with breast cancer, we have different bacteria that's actually noted in our breast tissue. Sorry about that. And I think this is really, really important. I think this is, now it was a small study. It was a very small study. They're going to have to do more research, but I think it's the beginning of, we're trying to still understand cancer, right? I think that there's places out there that probably understand it a little bit better. There's other countries that have cures for cancer out there that is known but not known here in the U.S. by many people. But I think that this is really important. I think this is going to help us understand cancer a little bit more. I think there's so much more to than our bodies than just the bacteria, but I think that this is really important. And what was interesting even too, now in this research, they actually looked at breast tissue microbiome, they looked at urine, and they also looked at the bacteria in our oral cavity. And what is interesting is that they talk about if you have like gum disease, that you are more likely to have like heart disease and other medical situations. And the thought process is that, in those pockets in our mouths, bacteria can enter into our bloodstream and therefore go throughout our body and cause these medical issues such as heart disease. what was interesting is how they found that there was different bacteria in our breasts when it came to what they did is they took samples from women who were having cosmetic surgery versus women who were having surgery because they had cancer. And there was actually bacteria difference between the two. But in the oral rinses, right, they found that there was no difference between cancer and non-cancer patients, despite some data that suggests that periodontal disease is associated with increased breast cancer risk. So it's really interesting. Bacteria in our body, I think, is so interesting. I think we're going to learn more. I think they're going to do more research. I think we're going to be finding out how important bacteria is and probably how much bacteria. I mean, we've got so much bacteria in our bodies. It's actually good stuff. And I think we're going to be finding out more and more about it. So definitely, I think it's something to look out for in the future. My last research that I have today that I found is another small. Now, some of these researches that I find, because they're about holistic kind of healthcare, sometimes they're small. But I think that the important thing is that they're small, but they're proving something that we need to do more research in these areas. And I think that is something that I think is very important. We need to start, even if we have to start small, we got to keep going from there. So this was a small study that was done in Australia, and it was actually about artificial sweeteners and about how artificial sweeteners can actually, in high amounts, like if we're using it all the time, okay, can actually affect how our body responds to sugar. It may actually increase our risk of diabetes, which I think is funny because of the fact that a lot of times, like people with diabetes will use non-sugar sweeteners because they can't use sugar. But it almost seems like this research is showing that if you're using that, it's going to affect the way your body responds to sugar. I think this is very, very interesting. And that this effect can happen as quick as 14 days. That's it. 2 weeks. That's not a long time, people. So they looked at 2 types of sweeteners. One was sucralose, which is Splenda, and the other one was acylfame K. I'm sure I'm mutilating that name. And that's under the brand name of Sunset or Sweet One. It's also found in sodas. And sometimes it's also, apparently, that's this acylfame is a kind of a little bit bitter, so sometimes it's mixed with other sweeteners such as Splenda, okay? It is often labeled as sugar-free or low-sugar product, calorie-free, okay? We got to look at those. We got to see what's inside these in order for us to really think if they're healthy, because they're saying that these artificial sweeteners are good for people who have diabetes. But now the research is showing that if we use these as quick as 14 days, it's going to affect the way that our body responds to sugar, putting us at risk for diabetes. So I think this is, again, another small research. I think this to me indicates we need to do more research, but it is a start, and I think this is some information that we should really, really, really know about and really think about, okay, they're saying that this artificial sweeteners are good. Are they really good for us, especially if you're diabetic? So let's see. Yeah, basically I'm sorry, I'm just reading my notes to remember everything about that research, but it was also just saying that these high sweetener intakes, so people who are always using these sweeteners, they're actually getting huge spikes in their blood sugar levels after meals. So, and that's definitely not going to be good. It's typically for like a diabetic, we're always looking at how your body responds to a meal or, some kind of whatever it is that we're intaking. We're drinking, whatever we're eating. Typically, a diabetic will take their blood sugar either an hour or 2 hour, what we call postprandial, because we want to see how your body is reacting to what you've intaked. And they're finding that those who use those artificial sweeteners ends up having a huge spike in their blood sugar levels. And for people who are not diabetic, it's putting them at a higher risk of diabetes. Hopefully that makes sense. Let me know if I'm making sense. I think Vanessa's watching. Hi, Vanessa. How are you? I hope all is well. So, this is actually, this took me a lot quicker than I thought. As you know, I'm doing, Vanessa, I'm doing a new format tonight. I just did the holistic news, and I talked about 3 different studies that I found. The first one was about lavender essential oil and how it actually helped with preoperative anxiety, and of course it had better outcomes than if you're taking any kind of, typically in perioperative, they will give you like either a sedative or an opioid, and of course those will have side effects, restlessness, fatigue, confusion, which unfortunately after your procedure sometimes makes you unable to participate in that post. Like when the doctor comes and says, "Hey, how you doing? I want to let you know how the surgery went." You're not going to be able to respond to that because you're going to be still groggy from those medications. So the research found that lavender essential oil actually was more beneficial, it was relaxing, and people fared better after their procedure, which was awesome. And then we had another, this is even more interesting to me, at least I think it is, about the breast tissue. The microbiome of the breast is different if you have breast cancer versus not having breast cancer. So again, very, very interesting and going to definitely be needing more research. So this show went really quickly tonight, everybody. Usually I'm on the show for almost an hour, and here we're almost like 30 minutes been on, and I've done all my holistic news. I definitely think I'm going to have to find some more. Again, this is a new format, everybody. I'm just trying it out to see how it is. I'm sorry, I'm always checking to see if I got comments from everybody. So, sorry about that. So, let me tell you, next week, I'm going to be doing a topic. I'm going to be doing what we call dysmenorrhea, which is painful periods. So I'm going to talk about painful periods. I'm going to talk about how we conventionally take care of it. And I'm going to also talk about how you can naturally and holistically take care of that as well. So if you have painful periods, if you know somebody who has painful periods, make sure to tell them to tune in next week at 8 p.m. on Monday. Please share this video. I love sharing this video with as many people. The more we spread out, the more women are knowledgeable, and that's what I love doing, and that's what I'm here for. If you have a show topic idea, put it down below in the comments. Please let me know what it is. Or if you have a private question, you can always message us via our Facebook page. There's a little messenger that you can reach out. And that's about it, everyone, tonight. I hope that you enjoyed our show tonight. It was definitely a little bit different. We're just going with the swing of things. We're going to see how 2018 and holistic news works out. If you like this, give me a thumbs up. If you want different kind of holistic news, tell me that too. If there's a certain area that you want me to look into, I would love for you to tell me. Remember, I do these shows for you. So thank you very much, everyone, for showing up tonight. I hope you have a fabulous week, and I will see you next week. Bye-bye, everybody.